I am sure you are wondering, what even are stimulants and amphetamines? In this video, I will be answering your question and hopefully scaring you away from these highly addictive and critical drugs. A stimulant is something that eliminates fatigue. It can excite or arouse you to a higher level of activity. Amphetamines are one kind of stimulant. They increase activity in the nervous system and cause psychological and physical changes. Some examples of these amphetamines are crystal meth, ice, and bath salts, also known as flakka. Now, the most common stimulant is known as Adderall. Amphetamines can be legal or illegal. They are legal when they are prescribed by a doctor and used to treat health problems such as obesity, narcolepsy, or attention deficit hyperactivity disorder, also known as ADHD. Amphetamines are illegal when they are used without prescription to get high or improve performance. In this case, they are known as street or recreational drugs, and using them can lead to addiction. I am now going to show a video of how easy it is for people to become addicted to stimulants, especially teenagers.
One of the things that people have a hard time grappling with is that the identity of the kids who abuse Adderall and other stimulants, they're not the druggies, smoking outside the gym door. Kids who abuse stimulants, some of them are kids who don't do anything else, who just feel as if I gotta study, I gotta study, I gotta study, I gotta study. People that young think that, well, it came from a doctor, what's the big deal? It can't be dangerous. A doctor who makes a careful diagnosis in a kid knows the kid's family history, knows the kid's health history, knows how to monitor side effects, things like that. But when that kid gives a pill to somebody else, you don't know what dosage you can handle. You don't know how to wean yourself off of it. You don't know what it may mean, if your skin starts getting kind of creepy, crawly. You don't realize that that's actually a rare but real side effect of amphetamine. So the perceived harmfulness of these things is so low and so much lower than it should be that you have kids messing around with stuff, and even probably some kids who wouldn't mess around with it if they knew what it was.
Stimulants create a cycle of feelings and behavior in users. When someone is high on amphetamines, they feel invincible, happy, and alert. But after those feelings fade, the person crashes and feels depressed, anxious, and nervous. In order to feel good again, they will have to take more stimulants and then crash again. That's the cycle. Get high, crash, get high, crash. Stimulants have very powerful short-term effects. They can change how you feel and how you act. When someone takes stimulants, they go through immediate emotional and physical changes. The first feelings usually are of euphoria, alertness, and energy. But some users become angry, impatient, and even violent. Other effects include loss of appetite, inability to sleep, and mood swings. Physical changes occur as well. Users have headaches, chest pain, or enlarged pupils. They also may talk very fast, make sudden movements, have a dry mouth, and clench or grind their teeth. The long-term effects of using stimulants are also very devastating. They include weight loss, a rash that looks like chickenpox, boils, gum disease that may result in teeth falling out, distorted vision, lung problems, uncontrollable shaking, and brain damage. There are so many other dangers. Users may suffer from fever, convulsions, high blood pressure, depression, severe fatigue, intense anger, nausea, vomiting, stomach aches, paranoia, blackouts, and even suicidal tendencies. A study claims 1 in 8 teens, which is about 2.7 million, now reports having misused or abused stimulant drugs. These drugs are very threatening. Stay away from them at all costs. It is not worth it whatsoever.